Hello everyone, welcome back to the channel. Today we are talking about a very important topic, leg pain and limping in the children. When a child comes in with a limp, it can be worrying for the parents and challenging for the clinicians to identify the exact cause. It might be something simple like a minor injury, or it could indicate a serious underlying condition that needs urgent attention. In this video, we will cover the common and critical causes of the leg pain and limping in the children and how to systematically evaluate these cases to reach the correct diagnosis and ensure timely treatment. So let's dive in and understand how to approach this presentation effectively in clinical practice. Now, the important causes of leg pain and limp. First important cause is growing pains. Have you ever noticed your child complaining of leg pain, especially at night, but being perfectly fine by the morning? These are what we call growing pains. Despite the name, they aren't directly caused by the growth itself, but rather by muscle fatigue due to the day's activities. Growing pains usually occur in children aged 3 to 12 years. The pain is often felt in both legs, especially in the thighs, calves, or behind the knees. Interestingly, it never causes limping or joint swelling, and the child remains active during the day. The exact cause isn't fully understood, but it is believed to be due to overuse of muscles or increased physical activity. Reassuringly, these pains are harmless and self-limiting. Simple massage, warm compresses, or gentle stretching usually help. Now, the second important cause is transient synovitis. It is the most common cause of hip pain and limp in young children, usually between 3 and 8 years of age. It often follows a recent viral infection and presents with a certain hip or groin pain, sometimes referred to the knee. The child may limp or refuse to bear weight, but generally looks well with no fever or only low-grade fever. Examination shows limited hip movement, especially internal rotation. It is a self-limiting condition that improves within 1 to 2 weeks with rest and non-steroidal anti-inflammatory drugs. However, always remember to rule out the septic arthritis, which is a medical emergency and is more serious condition. Now, next I will discuss the septic arthritis. This is a serious joint infection, most commonly affecting the hip or knee in children. It presents with acute onset of severe joint pain, swelling, warmth, and the child refuses to move the limb. They usually have high fever and appear toxic. It is caused by bacteria like Staphylococcus aureus entering the joint via bloodstream. Diagnosis requires urgent joint aspiration showing pus and raised WBC count. Treatment is intravenous antibiotics and emergency surgical drainage. Now, the fourth cause is osteomyelitis. It is a bone infection commonly affecting the long bones like femur or tibia in children. It usually occurs due to bacteria, mainly Staphylococcus aureus, spreading through the bloodstream. Children present with localized bone pain, tenderness, swelling, and may refuse to use the affected limb. Fever is often present. Diagnosis involves raised inflammatory markers, blood cultures, and MRI for early detection. Treatment requires intravenous antibiotics and sometimes surgical drainage if there is an abscess. Early recognition is crucial to prevent chronic infection and growth disturbances. Now, fifth cause is Leg-Calvi-Pert's disease. It is a childhood condition caused by temporary loss of blood supply to the femoral head, leading to avascular necrosis. It typically affects boys aged 4 to 11 years and is often unilateral. The child presents with a painless limp or mild hip pain that may be referred to the knee or thigh. On examination, there is limited hip abduction and internal rotation. The exact cause is unknown, but it results in collapse and later reossification of the femoral head over several years. Now, X-rays shows fragmentation and flattening of the femoral head. Management depends on age and severity, ranging from activity restriction and physiotherapy to surgical containment procedures in older children. Now, early diagnosis is crucial to maintain hip shape and function into adulthood. So, in leg Calvi-Perthes disease, osteochondritis can lead to avascular necrosis of the femoral head. The male-female ratio is 4 to 1 and the peak age is 4 to 7 years. Diagnosis is confirmed by radiography or MRI. Now, the sixth cause is slipped capital femoral epiphysis. Now, it is a hip disorder which is seen in overweight adolescents, usually boys aged 10 to 16 years. It occurs when the femoral head slips backward at the growth plate. Now, children present with hip, thigh or knee pain and may walk with an out-toeing gait. Examination shows limited hip internal rotation. It is an orthopedic emergency because untreated slips can lead to avascular necrosis. Diagnosis is confirmed with X-rays and urgent surgical fixation is needed to stabilize the hip. Now, neoplastic causes of leg pain or limp in children include bone tumors like osteosarcoma, Ewing sarcoma, as well as leukemia. Osteosarcoma typically presents with localized bone pain and swelling around the knee, while Ewing sarcoma may cause pain with fever and swelling. Leukemia can cause diffuse bone pain, limp, and systemic symptoms like pallor, bruising, or fatigue. Always suspect malignancy if pain is persistent, worsening, occurs at night, or is associated with systemic signs. Early diagnosis is crucial for timely oncology referral and treatment. Now, trauma causes include fractures, sprains, and soft tissue injuries. Now, what you should need from your evaluation of the child with limp or leg pain. First, from history. Organic pain tends to be persistent, occurring day and night, and this organic pain interrupts play as well as the schooling, and it is often unilateral or located to a joint in particular. In organic pain, limp or refusal to walk is significant. Now, in history, weight loss, fever, night sweats, rash, or diarrhea point to the organic causes. Now, next important thing in the evaluation is, of course, physical examination. Examine the child lying down and also walking, and fully examine the limb and groin, not only the knee. Especially in the limb, look for the point tenderness, redness, any swelling, muscle weakness, or atrophy, and also limitation of movement from each joint. Now, in general physical examination, look for fever, rash, pallor, lymphadenopathy, or organomegaly, suggestive of any infection or systemic causes. Third important thing in evaluation is investigation and their significance. This is only if leg pain is thought to be organic. First is full blood count. There is high WBC count in infections, leukemia, collagen vascular diseases. And next is CRP, C-reactive protein, ESR, or plasma viscosity, which is high in infection, collagen vascular disease, inflammatory bowel disease, or tumors. Third is radiography. This is important in bone tumors, infections, trauma, avascular necrosis, and slipped capital femoral epiphysis. Now, MRI or bone scan is helpful in osteomyelitis. Now, some key points for leg pain. Organic and non-organic causes can be differentiated on clinical grounds. Leg pain alone is usually non-organic. Second, important features suggestive of organic disease are a child's refusal to walk, a limp, any physical sign or constitutional symptoms. And third key point, pain in the hip is referred to the knee. So children presenting with knee pain requires a full examination of the leg and the groin. I hope you liked the video. Thank you, and please like and subscribe.